It's not only because it's Black History Month that we must have this conversation, but it really is about the health of our community, those that we serve. And I know that we are all committed to doing this in partnership. And this past year, with dealing with COVID, has been difficult for all of us, for healthcare workers, for the community residents. And I just hope that we can continue working together as we address this. Now, to answer Anna's question around the results, this is something I'm not surprised by that, the results we've seen. We've seen similar numbers within the community as we did informal polls, and it's also reflective of other statistics, other numbers we've seen across different parts of the world, actually within communities, especially diverse communities with a large number of African, Canadian, Caribbean residents. Now, we knew that when COVID hit the world, and in particular this community, we knew that because of what we saw as the risk factors for transmission of the virus, that the Northwest Toronto community would be hard hit, simply because we have a densely populated community. We have many folks who work in essential front-facing services, who are going to work every day to ensure that the rest of us are comfortable. They're in front. They're in the grocery stores. They're in the factories. They're in the distribution sites, and they're traveling on crowded transit systems. Unfortunately, many of them are in precarious jobs that are not without paid sick days. So some are most likely going to work sick. With all of the things that we're told not to do. So it's unfortunate, and I don't want the results that we're seeing and the high positivity rates in our community to be a negative reflection on the people who live in the community. This is an amazing community with people who are hardworking. However, there's some structural issues that prevent them from living in a better circumstance. So as a result, they also have some high prevalence of chronic conditions that again make them much more amenable to hospitalization when they are infected with the virus, many with fatalities. And this is something that's heartbreaking for all of us who live and who work in this community. So from the moment that the pandemic was declared, community organizations, community healthcare providers, the hospital, our partners came together, and we developed mobile testing in our community to complement the testing that was at the assessment centers led by Humber River Hospital. We've been working with our partners such as churches, recreation centers, community housing buildings, shopping malls, to ensure that testing was brought close to those who needed it, so that they did not have to miss time up from work to get tested. We knew the importance of that for all of us. We offered wraparound supports to families, and we engaged community residents in our strategy to do outreach in the neighborhood. They're called community ambassadors, but they were our boots on the ground who were distributing PPE to their neighbors. They were learning about the evolution of the virus so that they can support knowledge translation in the community. And as a community health center, we facilitated this, but the community did the work. And now, as with the vaccine rollout, I see us playing a similar role. I see us working with our community, listening to our community so that they can inform us as to what we need to do to support them and to support the uptake of the vaccine, because we know that the vaccine will save lives.